Good evening, everyone. Thank you for coming out to our seminar on knee osteoarthritis and joint replacements. My name is Alexis Gordon. I'm a physical therapist here at Performance Physical Therapy. So throughout the seminar, we will be going over various definitions, what osteoarthritis is, how it affects individuals, and ultimately how we can help you feel better. So there will be some time for questions at the end, but if anything comes up throughout the seminar, feel free to ask then to engage participation. So I am sure you are all here today because either yourself or a loved one has or is currently experiencing some type of knee pain. You may have been diagnosed with osteoarthritis from your primary care physician. You may have had a friend who recently went through a joint replacement and you're wondering, is that the correct treatment for you? So throughout the seminar, I hope to address those questions as well as discuss the need for joint replacements, go over some treatment strategies to implement both before and after a surgery, and go over some tips to provide you with the most successful rehab. So to start things off, what is osteoarthritis? Often abbreviated OA. Osteoarthritis is the breakdown of the protective cartilage that lines our bones. Osteoarthritis is the #1 reason for joint replacements. It can affect individuals differently by presenting with different symptoms, but most commonly, people experiencing pain at or around the knee, stiffness that tends to be worse in the morning or after prolonged inactivity, loss of mobility, so you might notice that you're not able to fully straighten your knee or fully bend your knee, joint swelling, or crepitus, which is that grinding and clicking sound that you may notice as your knee moves. So this image shows what a healthy knee should look like. As you can see, there's that thick layer of cartilage on the ends of each bone that helps to cushion the joint as we bear weight and as we move our knee. You can also see that there is a nice joint capsule here, and inside there's synovial fluid that acts as a lubricant to help reduce friction as we use our knee. On the other hand, here's a knee that's affected by osteoarthritis. So the first thing that you see, that cartilage layer has begun to deteriorate, decreasing the joint space between both your thigh bone and your shin bone. You can also see the formation of bone spurs or osteophytes at the end of the bones. These can further restrict your ability to bend and straighten your knee. You can see that the joint capsule itself is swollen and thickened due to irritation and that inflammation in the synovium from that continued irritation at the knee. So, who does osteoarthritis affect? Osteoarthritis is a very common diagnosis that affects over 32.5 million US adults. While osteoarthritis isn't necessarily avoidable, there are some factors that place you at a higher risk for experiencing OA. Up first, a past injury or overuse. So we very commonly see this in physical therapy with patients who might have experienced a meniscus or a ligament injury in their past that wasn't properly rehabbed. These injuries then can affect you later on in your life, predisposing you to having OA. Age is a factor. As we age, there's additional wear and tear and stresses that are placed on our joints, increasing the risk for developing OA. Gender. After the age of 50, women are more likely to develop OA. This is believed to be due to changes related to menopause. Obesity. Individuals who are overweight or obese have increased stresses that are placed on their joints, increasing the wear and tear of that cartilage, again increasing their risk for developing osteoarthritis. And genetics. Research has shown that some individuals' bodies just aren't as strong as creating that protective cartilage layer, which can accelerate the wear and tear at the joint, placing you at a higher risk to develop OA. So while some of these factors you're not able to control, genetics, gender, things like that, there are other factors that we can start to focus on, making sure that we're living a healthy lifestyle to decrease these risk factors for getting OA. How is knee OA diagnosed? Imaging is your first thing that you might look at. An X-ray is typically something that will be done. With this X-ray imaging, physicians are looking at things like that decreased joint space. So is there that nice cartilage layer, or are the bones starting to appear closer together because we don't have that protective layer? With the x-ray, you can also start to see those bone spurs or those osteophytes that were shown in the previous slide. Different criteria that we can use to determine one's likelihood of having OA within physical therapy include the following. So up first is pain. This pain, again, at or around the knee joint. This pain increases with activity, but then decreases with rest. And then, in addition to pain, an individual who has at least 3 of the following is more likely to have OA. That age over 50, that increased wear and tear on the joints and that cartilage layer. Stiffness that improves with less than 30 minutes of activity. Once that joint gets moving, once that synovial fluid gets throughout the joint, you're able to move a little bit easier. But after that prolonged activity is that pain at the knee. Crepitus, again, that clicking, cracking noise that you might hear in your joints. Bony tenderness, feeling around the knee, is it painful? And then bony enlargement, again, likely due to that osteophyte formation at the ends of both those bones. So many of you may be sitting here right now saying, uh-oh, she's describing exactly what I'm feeling. But the good news is that although osteoarthritis is very common, it's not always symptomatic. So a recent study showed that X-ray osteoarthritis prevalence among asymptomatic individuals, these are people who aren't experiencing any pain symptoms, 4 to 14% in adults under the age of 40. But after the age of 40, these numbers increase to 19 to 43%. Osteoarthritis is very common. So the big thing to be aware of is don't be scared by your imaging. So many times we have patients come in and they say, my doctor told me I have the worst case of arthritis, or I'm bone on bone, and that's all that they are able to think about. They think this is the end and there isn't any recovery. But there are often other factors that are resulting in the symptoms that you are experiencing. And that's why it's really important to have a full evaluation to determine if other joints are being impacted, which is resulting in your specific pain. Many individuals do respond very well to conservative treatment for osteoarthritis. Physical activity has been shown to improve arthritic pain, function, mood, and your quality of life. Many individuals benefit from transitioning to lower impact exercises such as walking, biking, swimming, or yoga. Different activity modifications for your specific interests can be discussed with a physical therapist to make sure that you are getting back to the activities that interest you. And physical therapy. So going over how physical therapy can improve your osteoarthritis symptoms. Various different treatment methods that can be implemented based on your symptoms, treating your specific symptoms to make sure that you are getting that full quality experience. First up, things that we can focus on is improving your range of motion. If your knee isn't moving properly, stresses are going to be placed that it wasn't designed to handle. So by making sure we're getting that full range of motion, that's going to overall improve our body mechanics and decrease the stresses placed on the joint itself. Different types of muscle strengthening exercises to make sure that that stress is being taken off the knee itself and distributed throughout the other muscles of the lower extremity. We can use types of manual therapy to decrease pain and then improve your activity participation. Again, as I mentioned, we can go over different types of activity recommendations. If we need to modify your position or make sure that you're doing an exercise before you go on your walks to improve that muscle activation and your range of motion so that you're able to walk further and without pain. The other really important part is making sure that we're addressing the body parts around the knee. So while we're protecting the knee that is symptomatic, other parts of the body are likely being overused. So by improving our strength and our range of motion in other aspects, particularly the hips or the ankles, the joints above and below the knee, we're able to improve the function at the knee. Something that we find very often within physical therapy treatment is that individuals suffering from knee pain actually have really weak hips. So the hips are a much bigger muscle group that provide stability for down the chain exercises. So making sure that we have that good base of support up is going to decrease that stress placed at the knee. So now you might be sitting there thinking to yourself, but I've tried this. I've gone through a course of physical therapy. I've trialed injections. And my pain, it's still there. My pain is getting to the point where it's debilitating. And I'm no longer able to live the lifestyle that I'm looking to live. I'm no longer able to play tennis or go for walks or play with my grandkids. That's when it's really time to start considering a knee replacement more seriously. So things that you might start to notice in your later stages of arthritic pain are gait changes. You might notice that you're not able to fully bear weight on that affected side. You might notice that you start to walk with a limp because that's affecting your pain. You might notice that more joints are starting to hurt. Those hips are overcompensating, or those ankles are overcompensating because you're not able to use your knee as it was designed. Something to take into consideration when considering a knee replacement is age. Ideally, a knee replacement should be deferred as long as possible to decrease the likelihood of having to have a revision surgery. As medicine and the materials used for knee replacements continues to improve, it's not uncommon that you're going to get at least 15 years out of your new knee. But this isn't a guarantee. So by pushing it off, you're decreasing the likelihood of needing a revision surgery. Other things to take into consideration when deciding if a knee replacement is right for you would be other medical conditions. So things like cardiac problems, or if you're a diabetic, or if you have any type of immune deficiency, this is going to play a factor in your recovery after the surgery itself. You may have a prolonged recovery, so just things to take in mind when you're considering if a knee replacement is right for you. When deciding on a knee replacement, preparation is key. The better you go into the surgery, the better you're going to come out. So, what do I mean by this? The more strength that you have, the more range of motion that you have, and the more flexible that you are is going to lead to an easier, faster recovery after the surgery. You want to make sure that you are decreasing any compensations as much as possible. So things like those gait changes that we talked about before surgery. If you're able to improve those mechanics before going into the surgery, you're going to have an easier recovery after the surgery. So the sooner you start, the better carryover that there will be after that. That is where preoperative physical therapy can come into play. Physical therapy, again, can help to identify those deficits that you might not even be aware of because you're so focused on that pain that's occurring at the joint itself. So we can help to create some exercises and then eventually create a home exercise program personalized to your deficits to improve those things that I talked about, that strength, mobility, and range of motion to improve your outcomes after surgery. Physical therapy can also help to educate you on an assisted device that you will be using after the surgery. After a knee replacement, you will most likely be using a walker. So a physical therapist can go over how to safely use this walker to benefit you and decrease your risk for falls after the surgery. Aiding in a safe transition to home. So making sure that you're able to maneuver throughout your house. If you have steps, making sure that you're able to safely get up and down the steps and go over any home modifications, such as taking up area rugs or getting additional equipment such as a commode or a toilet seat raiser to make you as comfortable as possible after the surgery. And then answer any additional questions or concerns that relate specifically to what you're experiencing. So I mentioned a walker. When using a walker, the first step is making sure that it's sized properly to you. An easy measurement to make sure that the walker is the correct height. With your arms by your side, you want to make sure that the handle of the walker hits your wrist crease. This makes sure that you're not leaning over too far and that you're able to comfortably reach the handles safely. The next thing when using a walker, you want to make sure that you are always within the base of support of the walker. A lot of the times when people come into physical therapy, we see them holding their walker all the way out here, and they're much further back behind their walker. This is decreasing their safety and increasing your risk for falls. Up next, when you are going from sitting to standing with a walker, you always want to make sure that you are pushing from the surface that you're leaving from and never pulling from the walker. The walker is an unsteady surface. So by pulling from that, you're going to, again, decrease that base of support and increase your risk for falling. And then as I mentioned earlier, being aware of any changes in surface, anything where there's a little bit of a lip, the walker isn't going to slide over easily. So being conscious of these things and making sure that you are as safe as possible following the surgery. After having a walker, you will likely be transitioned to a cane. A cane is sized the same way as a walker. Again, arms by your side, making sure that that cane comes up to about your wrist crease. So the picture, her walker or her cane is actually a little bit higher than it should be. Ideally, you want a little bit less of an angle at that elbow to decrease any stresses put on other parts of the body. When using a cane, it should always be used on the strong side or your non-operative side. And the reason for this, when you're walking, the cane and your operative leg should be moved together so that the weight is distributed between those two. So when you are walking, the cane and that operative leg will move together so that you're able to distribute that weight. Stairs are the tricky thing after surgery. So the best and most simple way to go up and down stairs after your surgery are to make sure that you are going up with your strong. Up with the good, down with the bad. So putting 2 feet on the same step, leading with your strong leg as you're going up the stairs, and leading with your surgical operated leg as you're going down the stairs. These type of techniques can even be implemented before surgery. If you're having a day where your knee is really bothering you, going up with the stronger leg and going down with the weaker leg is going to decrease the stresses that are placed on that knee. When going up and down the stairs, always use the handrail. We don't want any falls after a surgery or any falls in general. So making sure you are as safe as possible, holding onto that rail for safety. And after a knee replacement, going down the stairs tends to be more difficult. So going down the stairs requires increased knee flexion, which is something that takes some time to recover after the surgery. So don't get frustrated if you are still going with the 2 feet on the same step. Give your body time to recover. So with majority of joint replacement surgeries being in the outpatient setting these days, patients are typically discharged home within the same or the next day. Therapy services will most likely begin before you are discharged to make sure that you are able to transition home safely, making sure that you know how to get in and out of your car, go up and down stairs, all those things to make it as comfortable of a transition as possible. After being transitioned from the surgical center, you will either begin home physical therapy, where a physical therapist will come to your house and work on different things such as transfers, walking, and some strength training, or you will begin at outpatient physical therapy. It's up to your surgeon which they recommend first based on your specific needs. So, something important to note, regardless of where your surgeon recommends you go, you have the ability to choose where you're receiving physical therapy. And obviously, we would love to have you at Performance. This is something that we deal with regularly, so we know how to provide those best, most optimum treatments to give you the results that you're looking for. Other considerations to think about as you are recovering from a surgery. Nutrition. Your body is going through a major surgery. Making sure you are fueling yourself with healthy, whole foods, trying to decrease your sugar and your junk intake is going to accelerate your recovery and leave you feeling better. And some sleeping tips. You will be very uncomfortable the first couple of weeks out of surgery. There's no avoiding that. It's a hard recovery, but you will get there and you will have good improvements. But making sure that you are sleeping, making sure you are getting a good amount of sleep throughout those first couple of weeks is really vital for having the proper healing. So some tips for improving your sleeping. Your pain medication from your surgeon is prescribed for a reason. Taking it as needed is really important. Some people try to avoid it and then they lay awake in pain at night. Making sure you are taking it to sleep comfortably is very important. Other tips such as decreasing your evening liquid consumption or electronic use so that you're able to fall asleep faster and stay asleep for as long as possible. And making sure you have the ideal sleeping conditions. Some individuals find that sleeping in a recliner is the most comfortable position for the first couple of weeks after surgery. Sometimes kicking your spouse out of bed so you have a little more room to make yourself comfortable is an ideal condition. Positioning with pillows around the knees or around your body to give yourself support and stability is beneficial. So as I said, those first couple of weeks after surgery, you're going to be uncomfortable. You will likely be sent home with a bandage that looks similar to the one in the image. This bandage will stay on until you have your follow-up with your surgeon to remove your sutures. This bandage is waterproof. It's tight though, so it will restrict some of your mobility. The most important aspects in these first couple of weeks, managing pain. Again, a couple of tips to use this. Taking the medication your surgeon provides. It's there for a reason. Taking it as he recommends is important. Preventing overuse. There may be a couple of days where you are feeling really good and you want to jump back into all those activities that you were missing out on. Giving your body time. A slow return to your previous activity is going to decrease any big flare-ups and symptoms and then delay your recovery after that. And ultimately avoiding any uncomfortable positions early on. So we typically don't recommend things like getting down to the floor or doing yard work, things like that within those first couple of weeks while that majority of that healing is occurring. For the first couple of weeks, ice and elevation are going to be your best friends. Making sure that you are elevating that leg so that the knee is above heart level. Sometimes we see people sitting in their recliner with their leg just up in front of them. We need it all the way up. So laying flat with the leg propped up on a couple of pillows is going to put the body in an ideal position to decrease that swelling at the knee, to get that range of motion back. Monitoring your incision. So as I said, that bandage is likely going to be there for typically a first week or two after surgery. Making sure that you're not getting any drainage through that bandage. Making sure that everything under is healing appropriately and you're not noticing any fluid. Once we kind of start the basis of that, we get you into some of the physical therapy training such as gait exercises and exercise initiation. Something that we tend to use here after surgical rehab is neuromuscular electrical stimulation. So, sounds a little scary with electrical stimulation, but set up very similar to a TENS unit, which many of you may have used to manage your own pain symptoms. The way that it's set up, there's little sticky electrode pads that go right to your skin. After a knee replacement, we work primarily on the quadricep, the big muscle in front of your thigh. So what the neuromuscular electrical stimulation, or NMES, does is it sends an electrical impulse to the nerve to improve muscle contraction. After having chronic pain or after having surgery where there's increased swelling, our body isn't able to fully contract that muscle. The brain to the muscle sending that impulse isn't fully getting there. So the neuromuscular electrical stimulation helps to improve that contraction and improve your overall strength. So it's used to retrain or re-educate that muscle on how to properly activate so that we're increasing our overall strength. This quadricep strength is really important for a lot of our functional activities, such as walking, going up and down stairs, or transfers, getting in and out of a chair, in and out of your car, rolling over in bed, all those things. So making sure that we're getting that proper muscle activation after surgery is going to help to speed up our recovery. So as we're starting to get to the end of the presentation here, I want to make sure that we are setting you up with some exercises that you can get started with, regardless of where you are in your stages right now. So these exercises are going to focus primarily on that quadricep muscle that I was just talking about, as well as the hips, which we were talking about earlier being very beneficial for decreasing the stresses going on at the knee. So up first here, we have a simple exercise called a quad set. Ideally, you want the leg that you're working with to be straight out on a flat surface, but you can do it sitting where you are right now. With that leg straight out in front of you, what you want to do, think about squeezing that thigh muscle. A couple of cues that we help to give patients to engage that muscle is to think about pressing your knee straight back down to the table. Sometimes the cue of squeezing your kneecap and trying to bring the kneecap up to you is something that improves the ability to engage that quadricep muscle. Holding that contraction for about 5 seconds and then relaxing. All these exercises, you can start off with about 10 repetitions, doing them 3 sets, kind of building them into your regular workout routine. Up next, knee kicks. So now working on that quadricep muscle through more of a dynamic motion. So sitting on the edge of your bed, the end of your couch, a comfortable chair, things like that. What you're going to do, again, squeeze that thigh muscle. Leg's going to start to straighten out. At that end range where that knee is straight, give an extra squeeze, and then slowly lower the leg back down into that starting position. So now we're getting more of that mobility as well as that muscle control. So improved carryover to functional exercises such as walking or going up and down stairs. Clamshells. So a really good exercise to start engaging the muscles on the sides of your hips. For this exercise, you can do it laying on your bed, laying on a yoga mat, something where you're comfortable. You're going to start on your side. Knees are going to be bent. Ankles and knees are going to start stacked. You want your ankles to stay together and your top knee is going to lift up. When doing this motion, you want to make sure that you aren't rolling your pelvis backwards and you're keeping your hips pointed directly in front of you. Once we start to roll, we're working more on momentum for some muscle contraction itself. And lastly here, some hip kicks. So now getting through a larger range of motion, similar to how the quadricep was working. 2 different motions here. So starting by a sturdy chair, a countertop, something like that to decrease the risk for falls and take the balance component out of it. What you're going to be doing, standing on one leg, first exercise is your leg is going to kick straight out to the side. When doing this motion, you want to make sure that your toe is pointed in front of you. So we don't want the foot to start turning out, but I want your toe to stay right in front of you. So that's the first exercise. These ones are really good to do on both sides, regardless of the one that you're just feeling the pain at. Because that leg that isn't working is taking all that weight bearing. So you're working on that single leg stability and getting all that muscle activation down the chain. The second exercise we have here, again, is the same setup, sturdy chair or countertop. You're going to now kick the leg straight backwards. So for this exercise, you want to make sure that you are squeezing your glute muscles, squeezing the cheek, getting a good pull here, kicking the leg backwards. So, in summary, osteoarthritis is a very common diagnosis that does affect many individuals, but it affects individuals differently. That's why it's important to take those next steps with physical therapy intervention, talking to your doctor, getting a script, getting a full evaluation to make sure that we're treating the whole problem and not just isolating to the problem that's talking to you. Exercise is important both before and after joint replacements. As I was saying earlier, the better you go in, the better you come out. So the good thing is many of the exercises that you do conservatively are similar to the exercises that you do after surgery. So by strengthening those same muscles and seeing how you improve and respond to them is going to help you with your recovery after surgery. Physical therapy can be used to create a specific plan for your needs to improve your outcomes after surgery. And ultimately, be patient. Your body is going through a major surgery, and healing is a process. So give your body time to respond, give your body time to rest, and fully recover to get back to all the activities that you're looking to get to.